Hello everyone, it's Rafael Gutierrez. Welcome to my channel. Today I'm going to be talking about the spine, the vertebral column, and why it's important and problems that can happen when you actually don't have a proper spine alignment. Now, one of the things I did is if you look here closely, you'll notice that I did put a green line going straight up. I try to make it as straight as possible after I drew the spine, and so it may be a little off, but if you actually were to draw a straight line, you'd actually see that your spine is not straight. I have seen a lot of pictures online where people actually claim, oh, look, this is a straight spine and that's the way you should be it. If you do that, you're going to end up messing up your back beyond belief. And there's a lot of data that can actually tell us that. Now, I am going to give you the names going down, and then I'm going to start with the bottom and go back up. So if you look at your spine, you actually see this would be the back, this would be the front, this would be posterior, this would be anterior. If you look at from the posterior to the neck, you'll actually see a concave curve on the neck, and that's actually needed so your head actually sits the way mine sits, where it's actually on top and looking forward. If it wasn't like that, if it was just straight, your head would be at a weird angle. With that concave appearance is needed for function and to allow the nerves that are in the spinal cord to go through there. Now, the next part is called the thoracic area. Thoracic area is where your ribs are, and so you actually have 12 thoracic vertebrae. I actually draw 12, by the way, but that's actually where the thoracic area is. Lumbar area, well, the thoracic area, you can actually see that it goes convex, so you have concave, convex, and then you go to the lumbar area, which is your lower back, and you can see it goes concave again. Now, there you have 5 bones. And then you have the sacrum, which is 5 fused bones, and that's actually where pretty much where your hips come in and your legs, pretty much your legs attached to your hip bone, which is called the os coxae, which I'll talk about later. But that's actually a bone that it's really hard to get to unless you have a whole skeleton because of the amount of musculature in there. And then you have a little bone way down here called the coccyx. Now, starting with the coccyx first. The coccyx is what people call the tailbone. And a lot of people, for some reason, tend to say that the tailbone is not needed. That's kind of wrong, actually completely wrong, because there's a lot of ligaments and tendons that do come in there, and it does help support what's known as a pelvic floor. Now, one thing about the coccyx is there are a lot of people who end up breaking this, usually by falling on their gluteal region, on their buttocks, they fall on their ass, if that's what you want to say. If you think about it, it's a lot of force that actually goes into it. I weigh 200 and some pounds. If I fall on myself, that's the acceleration of gravity is roughly 9 meters per second. It's about, well, I'm a little under 2 meters, so that's about halfway mark. So about a meter fall, it's going to hurt and it's going to break. And when it breaks, walking becomes really difficult. Sitting becomes really difficult. You need time to heal, and that's where problems arise. Now, interesting thing, and those of you who are married or have kids, and or even if you would want to know something about pregnancy, there are women who actually break that when they're delivering. I usually tell people think of that when you're considering whether you should get anesthesia or not during childbirth. Then you have the sacrum. Now, sacrum actually originally had a name of os sacrum, but the os was dropped out and we just have sacrum. And the sacrum is attached to the hip bones. Like I said, it's called the os coxae. In particular, it's attached to an area of the hip bone called the ilium. So some of you may have heard of ileocecal dysfunction. Ileocecal dysfunction is where the ilium and the cecum actually separate a little bit. And it's extremely painful, and it's one of the main causes of preventable back pain. A lot of times there are people who do get it from trauma, but sometimes using the wrong posture can end up leading to that. Now, what most people say happens is this. If you actually look at your leg, it can only be extended, going backwards, to a maximum of 30 degrees. That's a maximum of 30 degrees. Most people will not get to 30 degrees. Most of the people who go to 30 degrees are usually ballet dancers, and so your choice. So just to give you an idea, if this is 90 degrees, right angle here, there you can see it if I put it there. 30 degrees, 45 degrees would be about here. 30 degrees would be about here. So this area here, this angle here, would be, I'm trying to see, here, there, put my hand there. That angle here would actually be, do it down here, 30 degrees would be about like that. Get a better look, there. Now, what that means is, if you do a really long stance, you're no longer using your legs for the extension, for bringing the leg back. You're using your sacrum. And what the problem with that is, if you have your leg, I'm going to use a different color. If you have your leg coming this way here, and let's say your front leg coming this way here, if your back is coming at this angle, you'll notice that this is far beyond 30 degrees, which means that your sacrum actually starts being put under pressure. So we have our sacrum, like a triangle, and it is going to end up having to rotate. So instead of being a natural sacrum coming like this, it's going to rotate forward. And when it rotates forward, it's going to be like this. So the only way you can actually get that 90-degree angle to the floor here, if this is the floor, 90 degrees here, is if you're putting pressure on your lower back, your lumbar area. Now, that pressure isn't just on the sacrum, but it's actually on the ilium as well. And it can actually cause slight separation of the sacroiliac joint. That ends up leading to SI dysfunction. And if you do get that, it can end up causing pain for the rest of your life. Back pain is one of the most disabling things that you can come across, so probably something you want to avoid. So the way to avoid that is, if you have really deep stances, you do what actually fencers do, which is straighten your lumbar area. And that tends to relieve some of the pressure off the sacroiliac joint and moves it to different areas, which I'll talk about in muscles. It actually moves it to muscles. That's why you'll see a lot of people who do long types of stances for different sports will actually be leaning forward. Now, the lumbar area. Lumbar area is a lower back. And again, you have a nice curvature. There are some people who, for some reason, are told to try to get a straight back. And if you do have that, there's a condition called hypolordosis. Hypolordosis means that instead of having a curve here, your back gets flat. It's flat back. So in hyperlordosis, the problem that happens is, first of all, you narrow the opening where the nerves run. You have a flat lower back, you get something called lumbar stenosis, and it's a narrowing of the area where the nerves and the spinal cord is going through, which can end up being severe, and a lot of times can end up leading to permanent dysfunction. A lot of times it can end up leading to disability. If you know anyone who has back pain, they will probably tell you that there are some times, especially if it's severe enough, they can't even get out of bed. So that's hypolordosis. There is another case called lordosis, and that happens mainly when people are carrying too much weight. So the spine, instead of having a normal curvature, sways forward. That's the reason some people call it sway back. And again, that causes the same narrowing and can cause impingement of the nerves. Beyond that, it can also do some other stuff where the discs that actually are between the vertebrae, the bones here, can actually push out and end up pressing on the nerves. When you get that, you can start with medical treatment, but chances are, if it progresses, you will end up needing surgery. And so that's actually one of the problems with pretty much taking your back and arching it. Oh, by the way, if you look at this stance here, problem is your lower back, instead of being a normal curvature, you actually will tend to use the lumbar area to overcorrect. So you'll actually be overcurved. You'll actually have lordosis temporarily, which again can lead to problems. Now I know someone says, Well, but I was told that this is the correct way to do it. Well, it's a correct way to do it if you want to get lumbar stenosis. Great way to think it through. The next one is the thoracic area. Thoracic area has a convex. It means it's actually coming out this way. You can see the line here. Again, it is not straight. Now, the lumbar area does give you a little bit of ability to move side to side. The thoracic area, usually its movements tend to be more to help take breath in and out. Take breath in and help them come out. So you need this type of movement. If you have a straight back, you actually change that dynamic. Again, there are people who have that. And there's a irregular back curvature that happens in the thoracic region, which is called kyphosis. Kyphosis usually happens, it's an abnormal curvature. So if you're actually a person who constantly stands like this, you can end up actually causing a little bit of kyphosis to you. Your curvature actually changes. The problem with that is, as this is used for breathing, coming up and staying like this too long, like that, makes it hard to breathe. If you think about it, come down like this, take a deep breath, and see how it affects you versus coming up. You'll see that there is a difference in breath. Now, that's actually one of the reasons why, if you actually talk to a lot of people in karate, if you want to maintain your breath, if you're an athlete, usually you want to maintain a neutral spine. Not straight, but neutral, meaning you actually maintain the normal curvature. Then you have the cervical region. Now, the cervical region is fun more in the sake of the fractures that can happen there. I don't mean having the fractures, but talking about it and learning about it. And there's really 3 types of fractures that we can talk about in the neck. One of them can be divided into 2 types. And we'll actually are going to avoid the first 2 fractures. The first 2 cervical vertebrae, which are way at the top. And I'm going to talk about the fracture that can occur from the 3rd cervical vertebrae all the way to technically the 7th, but usually it's 3rd to the 5th. And those are actually usually referred to as teardrop fractures. The reason they're called teardrop fractures is when they do produce that fracture, usually there's a teardrop shaped bone that fractures and is kind of left in there. And sometimes that teardrop can cut the spinal cord. Problem with that is you can die or become paralyzed for life. Again, not things to actually worry about. Now, not things that you really want to have. Now, a lot of people will talk about breaking the neck. And one of the things is for this teardrop fracture, usually you need a major force. How big of a force do you need for a teardrop fracture? Well, usually these fractures are seen in rugby games or professional American football. You're talking about someone relatively big and athletic running at full speed, smashing into someone, and either causing the head to go back or forward. Another way people can actually get this one is sometimes when someone dives, their head can hyperextend or hyperflex, and you can end up having that type of fracture as well. Not a good fracture to get because, well, it can end up causing problems. If you're actually in a place where you throw people, sometimes that's actually a problem because if someone gets thrown and they land on their head, it can potentially cause that fracture. Think about the amount of force that is coming down to the head on that time. You're talking about whatever you weigh, pretty much your height coming straight down onto your head. Now, you can't really get that amount of force twisting with your hands like this. Think about it. For average, well, I'll talk about the other one. Now, the second cervical vertebrae is a little different in that it has a bony projection that goes into the first. It's called the bone actually has a name of the axis. And the axis can break pretty much in the area where the canal is. The 2 little hands that, pretty much the 2 arms that form the canal can break. And that fracture is called Hangman's fracture. It used to be the fracture that occurred when someone was executed through hanging. But for that to actually occur, someone has to fall at least, well, they did it with a typical adult male, which was 75 kilogram male, about 160, falling 2 meters, 6 feet. That's the amount of force you need to cause the axis to break. And usually what would supposedly happen is it would cut the spinal cord. Now, a lot of times people didn't know quite how to hang someone, and instead of actually breaking their neck, they'd break the trachea, which leads to other problems. Again, you're dealing with massive forces. Most of the time, people get hangman's fractures now. It's through car accidents or motorcycle accidents. The last one is actually one that is really interesting. It's called the Jefferson's fracture, and it's a fracture of the first cervical vertebrae, which is called the atlas. If you think of the guy who holds the world on his shoulders, that's atlas. So atlas holds up your world, your head. And the way that one actually usually fractures is taking a direct blow straight in the center of the head. Usually, again, happening either through diving or some people say spearing in football, which is why it's illegal. You need massive forces for this to break. Not enough that would be produced by spinning your hands around. The whole Hollywood martial arts thing where they take the head and it's like, hey, that's not going to happen. I mean, you have to be realistic. You're talking about forces that are beyond what is normally possible with just your two hands. It can't happen. And even if it does happen, one of the big things to actually know is that, just because the neck breaks doesn't necessarily mean that the person is done. I mean, there are some people who have actually come into emergency rooms with fractured necks, walked in, and pretty much scared the hell out of the emergency room because they could have actually severed their spinal cord. That's actually why anyone who falls on their head in any activity should really be evaluated by the medical professional. It shouldn't just be they're fine. No, you don't want, think about it. If you're an instructor, do you want to risk having one of your students die or lose the ability to walk? So that's one thing that I would tell you to consider looking at. There is one other back problem that can end up happening. And this is actually an interesting one because I ended up reading a report on how to prevent this. There's something called scoliosis. And in some people, if we actually were to put the spine, usually looking at it from front and back, you have right and left going straight down the back. It's usually relatively straight. I say relatively because of our handedness. So for instance, I'm right-handed. I tend to pick stuff up with my right more than my left. We tend to have a little shift because of that. Most of it is insignificant. But there are people who will actually have, instead of a spine being a straight line like that, their spine will actually either move like an S or a C. And that's called scoliosis. Now, if scoliosis is severe, it really needs surgical correction. If it's minor, you still need a medical evaluation to actually determine how minor it is. And sometimes actually physical therapists apparently will recommend having people do certain types of physical therapy and training where you actually use both sides. So if you think of a lot of martial arts, you don't just use one side, you switch and you actually practice using both hands equally, or sometimes they tell you to practice your weak side more. So it's interesting to actually see that it it doesn't necessarily have to be, but it may be that martial arts may actually be beneficial for people with really minor scoliosis. But before someone with scoliosis jumps in, please let them know to get evaluated to see if the doctor recommends it. And also be careful with trauma. If you're doing sparrings and throws, they may want to actually take a step back. If you're doing mostly kata, that's actually probably a lot better for them, or forms. So I hope you enjoyed this video. I am going to try to finish all the bones and muscles, and I am working on making a book so people who want to actually learn anatomy and really be able to understand every aspect of why things are done a certain way or better ways to do things, like most sports, can actually use it. I hope you enjoy this and have a nice day. What do you think?